thousands of years, women have been having babies naturally. In the present day, there are many more choices for mothers concerning how they choose to deliver their babies. Mothers can choose to have a hospital birth with a certified nurse midwife or with an OBGYN. There are also licensed midwives that perform home births. This is the choice every mother must make. But being a young woman, my question is, how do mothers know which choice to make? In the present day, young women between the ages of 13 to 35 don't know much about midwives, let alone the choice of midwifery. From the women I interviewed, the main view of midwifery is that it is an ancient practice that isn't really relevant in the present day. Most women that I did interview did not know any women who have delivered with a midwife before. What is your general impression of a midwife?
Well, I'm not really sure what a midwife is. I thought that was just something they did back in the old days, old times.
I think of a woman going to someone else's house and helping her deliver her child.
My general impression would be that a midwife is someone that you could hire outside of a physician or a traditional doctor that could assist you with delivering your baby, I think either in a hospital or for a home birth. And honestly, I would think that they might be less qualified than a doctor.
Do you know any women who have delivered with midwives before?
No, I do not know any women that have delivered with a midwife.
No, I would have to say I don't. All the women I know have gone into the hospital. They've either had a scheduled C-section or they have had an epidural and a delivery like that.
At Ochsner, Bethany Genre, a certified nurse midwife, agreed to do an interview with me about midwives and how she feels about her profession. What type of midwife are you, and how would you describe your profession to someone who doesn't know what a midwife is?
Okay, I am a certified nurse midwife. I was a labor and delivery nurse for several years prior to deciding that I wanted to do something a little more. So I was already a bachelor's prepared nurse and decided to go back to midwifery school. And in order to be a certified nurse midwife, our education is a master's degree, usually a master's of science or a master's of science in nursing, and then a certification and board certification in midwifery. So our specialty is obstetrics and well-woman gynecology.
Okay. Do you only work in a hospital?
I do. I'm a hospital-based midwife. There are lots of different types of midwives. There are some just licensed midwives who have like a 2-year training, and most of those do home births. Being that we were nurses first, and in the state of Louisiana, most certified nurse midwives only practice in a hospital setting.
What type of certifications and licenses are required to be a midwife?
It depends on the type of midwife that you are, but as a certified nurse midwife, bachelor's prepared, then a master's degree, board certified in midwifery, and then we have to stay current. So we have to do a certain amount of education hours. As an RN, I have to keep my education hours through the state of Louisiana, a certain amount of hours. And then I also have to do continuing education hours to keep my midwifery certification. We have to do modules, which is these study guides that you submit questions and answers every few years to keep yourself current.
That was actually one of my questions. Later on, do you have to keep up with your education and keep learning new techniques and
Absolutely.
Yep, stay current. Okay, next question. Are you a part of the state midwives organization? If so, what is the benefit of being a part of one?
I am in, we have the American College of Nurse Midwives is the national organization for midwifery. But we also have local chapters within our own state. So we only have about 15 active members, and the way we do that is we will meet as a group once a month. There's only about, last I heard, about 60 certified nurse midwives in the state of Louisiana, and truly only about 15 to 20 of us are pretty active in our local organization, and we do meet monthly between New Orleans, Baton Rouge, Lafayette, where most of us are pretty active participants, and it keeps us local on our, what's going on the national level. We do have a national midwifery conference that most of us do attend, just to see how everybody else is doing in the country.
Okay. How many births have you attended?
I lost count. My first year in practice, I used to keep a running tab of how many births I was doing, and after about 300 births, I stopped. I'm well into the thousands now, and I've lost count.
How many per day do you think?
We average, when I am on call, the way we do things, I see patients in the clinic. When I am on call, I take call for 24 hours at a time, and I will average about 3 births per shift.
Oh, wow. Okay. Do you have assistants that accompany you in the births? If so, how many assistants do you normally have, and who are they?
As a nurse midwife practicing in a hospital setting, I'm working in a birthing center where the nurses are my assistants.
So you have other nurse
There are
midwives in there?
no other nurse midwives.
Okay.
The labor nurses who will take care of mother and baby.
Okay.